Hi, so today I'll be doing a video about gastroesophageal reflux disease, also called as acid reflux. Now, to understand this, we should understand what is acid reflux. A brief knowledge about the anatomy of food pipe and stomach is necessary to understand acid reflux disease. As you can see in the picture, the esophagus, also called as the food pipe, is predominantly present in the chest, whereas the stomach is present in the abdomen. The acid is mainly in the stomach and is not supposed to go back into the esophagus. So when the acid refluxes from the stomach back into the esophagus, which is in the chest, it results in acid reflux, commonly leading to a symptom of heartburn. So once we have understood the anatomy, the acid reflux is nothing but the reflux of the gastric acid from the stomach into the esophagus. As we understand, the pH of the gastric acid is very low, and the esophagus or the food pipe mucosa is extremely sensitive to such low pH. Thus, when there is acid that refluxes back from the stomach into the esophagus, it generally causes a burning sensation which leads to an acid reflux. When does such an acid reflux happen? Under normal circumstances also, we do get some amount of acid reflux. So when does it happen? It happens on consuming a lot of spicy food, lot of hot food, alcohol, smoking, exercising soon after having a meal, going to sleep soon after having a heavy meal, and overeating, pregnancy, obesity, etc. So these are the conditions in which some amount of acid reflux is expected. But when does acid reflux become pathological? It happens when, in spite of avoiding all these substances, the person has a constant level of acid in his food pipe. This results in a condition called as GERD, that is gastroesophageal reflux disease. So what are the symptoms of gastroesophageal reflux disease? Most commonly it is heartburn, that is severe burning in the chest, excessive burping, the need to drink excessive water during eating food, vomiting. Sometimes there is even acid in the throat which causes hoarseness of the voice. Occasionally there can be acid coming out through your nose in severe gastroesophageal reflux disease. There can be breathing difficulty and asthma. And in some, the reflux is so bad at night that they are unable to get a good night's sleep. Some of them also tend to lose some amount of weight because their appetite comes down due to the problems that happen soon after eating food. So these are the common symptoms of a gastroesophageal reflux disease. How is it diagnosed? The diagnosis is majority by clinical history and examination. An endoscope will help in confirming the diagnosis of GERD, wherein it might show some injury to the food pipe or esophagus mucosa because of its constant exposure to the acid. There are certain advanced tests which I will discuss when we are discussing the surgical treatment of GERD. How do we treat GERD? Now, to understand how do we treat GERD, we have to divide it into two plans. One is lifestyle modification, the second is medications. Lifestyle modifications are very important in treating GERD because these are the ones that will give you long-term effect. So, as I discussed initially, you have to avoid eating spicy food, you have to avoid drinking a lot of hot liquids and hot food, you have to avoid overeating, you have to avoid eating soon before you go to sleep. and no exercising soon after consuming food. If you are overweight or obese, you have to make an attempt to reduce weight. No smoking, no alcohol. The best way to have meals for people who have gastroesophageal reflux disease is small and frequent meals. So you are supposed to eat small quantity and you are supposed to eat once in 2 hours. With that, what happens is your stomach never gets over distended and hence the reflux of acid into your esophagus reduces. You should have dinner at least 2 hours before you go to sleep. And sometimes elevating the head end of the bed by 15 degrees while you go to sleep at night will also help. So if the bed is, generally the bed is 180 degrees, slightly give a head end elevation of about 50 degrees and that will reduce the nighttime reflux and thus will help you get good night's sleep. So these are the non-medical ways of treating acid reflux by making adjustments in your lifestyle. There are medicines for acid reflux. So first most commonly used medicine is a PPI. We call them as proton pump inhibitor. They are anti-secretory tablets. Most common and widely known is the Pantocid or Pan-40 tablets that most of us have used at least once in our life. These mainly act by reducing the pH of the by increasing the pH of the gastric acid. Hence, once the pH increases, so your reflux symptoms come down. The other medications that are used are oral syrups. They can be direct antacids. Again, they act in trying to increase the pH of the stomach, or they can be local anesthetics. That is, they coat your esophagus and stomach so that the acid does not have a direct impact on your mucosa, thus reducing the injury. So these are the medical ways in which we treat gastroesophageal reflux disease. There are some patients though who will need a surgery for gastroesophageal reflux disease, and these are patients who have a very severe form of disease. About surgical treatment of gastroesophageal reflux disease, I'll be discussing in the next video. Thank you.